Okay, this is also a series of lectures on mood disorders, but it's a different set of slides that gives you some different information and perspective. A mood disorder is a condition where the prevailing emotional mood is distorted or inappropriate to the circumstances. I kind of like this definition a little bit better. The emotional mood, it's over-exaggerated for the situation and for the length of time that the situation warrants. There are two types of mood disorders, and we've talked about these: depression and bipolar. There are four basic forms of mood disorders. We've talked about major depression, cyclothymia. We have not talked about SAD, or seasonal affect disorder, and we have talked about mania. Now, cyclothymia is a mild form of bipolar disorder, and mania, it is distinguished by a person being extremely euphoric, hyperactive. They might have an overinflated ego, unrealistic optimism. About 20% of the U.S. population reports having at least one depressive symptom in a given month. 12% report two or more in a year. A major depressive episode, it can manifest itself with a variety of symptoms, but almost all who experience such an episode will display either a pervasive low mood and a noticeable loss of interest in pleasure, anhedonia, in favorite activities. Now, again, we've talked about how there are a plethora of symptoms that go with major depression. A person can be depressed and not look sad. They can be very irritable, restless, have insomnia, and have depression. There are just a lot of different ways that depression can show up, and reiterating that this is one reason why sometimes doctors get a bad rap, because one will diagnose depression and the person thinks, I'm not depressed at all, when they're exhibiting all the different symptoms. And another person, say, well, I think he's right on, I'm sad and I don't feel like eating and I'm lethargic. Well, yeah, that typically depression, but that doesn't mean that that's the only way it can manifest itself. We sometimes misuse the word depression. Depression, the major depressive disorder, that's what's treated. Now, sometimes people will just refer to having the blues as being depressed. And so, we want to make sure that we try and use the correct term for the problem. All right, now this is in the DSM-4, so I'm not going to go through this. We have talked about the criteria in the other lectures, and so I'm going to go ahead and pass through these. Now, here's some of the things that the other did not list out as well. Mood-related symptoms can be a persistent sadness, anxiety, irritability, feelings of worthlessness, hopelessness, inappropriate guilt. They may feel helpless, hopeless, may be very pessimistic, very irritable, restless, having problems sleeping, difficulty in thinking, concentrating, remembering, or even making decisions. Now, there are physical symptoms associated with depression. That can be either an increase or decrease in weight, or an increase or decrease in appetite. Insomnia. Now, insomnia, technically the word insomnia means inability to go to sleep or inability to stay asleep once a person is asleep. So insomnia, waking up too early in the morning, sometimes just being so fatigued that you oversleep. Decreased energy, fatigue, feeling slowed down, sluggish. These are all physical symptoms, including a persistent physical symptoms such as headaches, stomach aches, digestive problems, chronic pain. Others may report that the person feels agitated or slowed down. Now, this will bring me to a place that I can kind of divert for a minute, or digress. Antidepressants, not only do they address depression, but many of them will have an added agent to address some of the physical symptoms. Like Effexor, that has an added component to try and help a person feel more energetic. Okay, there's another one that addresses pain. And so many times the antidepressants will address physical complaints as well as mental complaints. Depressed people normally will become more and more isolating and withdrawing from friends, social gatherings, family gatherings, activities, even activities they have enjoyed in the past. As the depression increases, they actually may start having more and more thoughts of death, additional thoughts of suicide, or may even attempt suicide. Now, depression used to be called unipolar depression, and it would include major depression recurrent, major depression with psychotic symptoms, dysthymia, and postpartum depression. Now, you can have depression single episode, which means this is the first one that you've had, but now that you've had it, more than likely it's going to occur again. Major depression recurrent, which means this is your second or more episodes of depression. Depression with psychotic symptoms. That means that depression has gotten to the point that there's starting to be a disruption in reality. Then you have dysthymia, which is kind of a low-grade but chronic depression. The person's constantly depressed, but they're on a low-grade type where they're functional, but they've been depressed for years and years, okay? And then postpartum depression, that's associated with depression after birth. A major depressive episode has been defined as a severely depressed mood disturbance that persists longer than 2 weeks. Again, episodes can be the first one, or it can be recurrent. They can be mild, they can be moderate, or severe. Any episode that has psychotic features will be automatically rated or categorized as severe. Now, the DSM does not include depression that is a result of bereavement. People grieve in different ways, at different depths, for different lengths. And some people will go into very, very deep sadness and sorrow with a loss. And depending how long this lasts and how much it starts interfering with day-to-day living, there's a little bit of wiggle room given to individuals who have experienced a grief episode. We have melancholic depression. That's a person that has depression that has lost the ability to experience pleasure, anhedonia, in most of the activities. and a quality of depressed mood that's more pronounced than that of grief or loss. A worsening of symptoms in the morning hours. They wake up very, very early in the morning, and they may have some psychomotor retardation, which means they're sluggish. They move real slow and sluggish. They may have had an exceedingly large weight loss and experience some kind of guilt. Now, this weight loss is not the same as a weight loss that's associated with anorexia. Then we have what's called atypical depression. This is where they have paradoxical anhedonia. Now, paradoxical means opposite. So this would mean that they are probably experiencing pleasure in an abnormal way, okay, but not where they're not experiencing it. People with atypical depression gain weight. They may have an increase in appetite and participating in comfort eating. They may be very, very sleepy. They want to oversleep. They feel tired all the time, and they want to, whenever they have a chance, they just want to go and take a nap. It can have a significant social impairment, and also starting to have where they perceive rejection from individuals that they have relationship with. Actually, contrary to its name, atypical depression is the most common form. Psychotic depression, that's the term for a major depressive episode, particularly one of a melancholic nature where the person will experience delusions and, less commonly, hallucinations or some kind of break with reality. Then we have mood congruent depression. And this is more suggestive of schizoaffective disorder rather than depression. Now, catatonic depression, this is very rare, and it involves disturbances of motor behavior. They can either have an overexcitability, or they can withdraw into themselves until they're just almost unrelating to the environment. As I said a minute ago, postpartum depression. It's a course of in the DSM that refers to somebody who has increased, pronounced despair after giving birth. It occurs in about 10 to 15% of the women, and typically sets in about 3 months, within 3 months of having delivered. It can last as long or longer than 3 months. As I said a minute ago, dysthymia, that's a chronic, mild type of depression. They will report just feeling low. I just feel kind of low. I don't feel all that happy most every day. And it says it can happen over a span of at least 2 years and longer. It's not severe symptoms, but people with dysthymia are vulnerable to secondary episodes of major depression, and then you've got double depression. Now, recurrent brief depression, this is different than major depressive disorder because primarily the differences in duration. People with recurrent brief depression, they have depressive episodes about once a month. And with these individual episodes, they will last about 2 weeks, and then typically less than 2 to 3 days. And then the diagnosis requires that an episode occur over the span of at least 1 year, and in females patients independently of their menstrual cycle. So this is going to be your PMS type of stuff. You have minor depression. That's a depression that does not meet the full criteria for major depression or the other types of depression that has been previously discussed, but it has been present for at least 2 weeks. There's a type of disorder called adjustment disorder with depressed mood. This is given for people who have an identifiable stressor that it causes a significant emotional response and or behavioral symptoms, but it really isn't deep enough, it's not long enough, it's not disabling enough to be categorized as depression. We've already discussed the different theories about why and how depression comes about, so I'm not going to go over this. The etiology, the exact cause is unknown. We look at heredity, we look at environment, we look at several things, but the bottom line is we don't have a thumb on the exact cause. Now, I don't know if we talked about that there was a link between the depression and the neurogenesis of the hippocampus. Here, the neurons from the hippocampus, there's a loss of these neurons, and it seems to correlate when we lose these neurons with impaired memory and a dysthymic type mood. In this, drugs can increase serotonin levels in the brain, which stimulates neurogenesis, which causes an increase in the total mass of the hippocampus. This can help to restore mood and memory. Now, depression can also be caused in part by an overactive hypothalamic pituitary adrenal axis, HPA. This will resemble the neuroendocrine response to stress. The HPA axis abnormalities will participate in the development of depressive symptoms. Antidepressants will serve to regulate this problem. Depression can be affected by variations in the circadian rhythm, disruption in sleeping, and we've already talked about the therapies, okay? I'm trying to okay. I am moving right here to a little bit more on wanting to talk just a little bit more about depression. First of all, everybody is going to feel sad once in a while. It's pretty normal. Now, there is a difference between feeling very sad and feeling depressed. Now, sadness can go into depression. Now, any emotion that you have is not right or wrong. It's what you do with it that's right or wrong. There's a thing called reactional depression, and that's what we were calling a minute ago, referring to when somebody has a loss. Okay? Now, some of the other things that can contribute to feeling and a heavy sadness that can cause a sadness that's deep enough that it resembles depression. There are some metabolic reasons. If a person has thyroid problems, it can cause a person to have such deep sadness that it could be called depression, okay? There are some drugs that can cause a person to have or present what would be termed depression. If you have a deficiency in vitamin B12, this can cause depressive symptoms. Different illnesses, they can result in a person feeling immense sorrow, like especially if somebody's been told they have a terminal illness or a very, very chronic illness that might result in pain. Psychopathologies, that's what we're talking about now, somebody that might have an actual diagnosis of depression. And then a thing called SAD, seasonal affect disorder. Seasonal affect disorder is a real and honest to goodness problem that some people suffer in the winter and in the fall. They are sensitive to sunlight, and they have to have sunlight for their mood to be elevated. When there is less sun, such as the fall increases, shorter days, winter, shorter days, as the days shorten, their mood will start becoming sadder and sadder. Now, this can come to a point where a person might have to actually have artificial light brought into their home, brought into their office to be able to function. Interesting thing, as soon as spring starts rolling around, their mood will start increasing. Now, another aspect of looking at depression, cognitive therapists and psychologists often will say that anger turned inward or unresolved grief will eventually lead to depression. And I'm one who subscribes to this. Now, because of that, I'm going to be giving the next lecture over grief. And so that will be the one that will follow this one, okay? So I'm going to close this particular lecture down, and then we'll start talking about grief, the problems with grief, what grief is, and hopefully a little bit of how to resolve grief. Until the next one, have a great day.